30%, 50. You're
Go
going to
ahead.
get a 30%, 90% THC in both markets. The only difference between medical and recreational marijuana is how it's taxed, but the products are pretty much the same. The problem with the testing is that they're allowing products to be consumed by the public before the testing results are available, not only in terms of content, but in terms of contamination. I mean, we've had several recalls of products that had arsenic in it, or cadmium, or mold and yeasts and all sorts of fungus, but those have already been consumed. So, I mean, the consumer protection is sorely lacking as well. But when it relates to content, you know, the industry may be saying they're doing this and testing potency, et cetera, which we know they need to know that anything over 10% is dangerous. You know, some people are maybe 15%. What the state of Washington just came out saying there's no need more than 30 or 35%, which I still think is too high. But they're restricting potencies. There's the only a high potent product is for addiction for profit. That's pretty much the simple answer. There's no need for this, and it's not natural. I mean, God did not create a marijuana plant that had 90% THC. That God's plant is 3 to 4% THC. And that's what people tend to talk about when it's the natural plant. The stuff that's around now isn't natural. It's been modified. It's been genetically engineered to breed out the CBD, which actually, despite its own harms, may be a little protective on the harms related to THC. And that's the thing. The gap between the THC and CBD content is widened significantly. And that's why I think we're seeing a lot of these, you know, acts of violence and you know, children have died from marijuana poisonings and they end up in the hospital because they're dangerous. I mean, just simply put, they're dangerous. So and when the patients consume these products, they have literally no idea what they're getting or taking. Because I asked my patients, I said, so you're using marijuana, what potency are you using? And all of them, 100%, I have no idea. They have no idea what they're taking.
Okay. So on that note, what we would hear in response to that, because that's usually the line that I go down. But what the industry says is, guys, you know, we're not asking for 90% so that we can prescribe 90% or recommend 90%. We are asking for 90% so that we can maintain I don't know, the integrity of the product, and then they dilute down with CBD or something like that. So they're saying that they don't need the 90% because that's what they want to prescribe in gummies. You know, they're saying that they need to, because of the processing. And again, it kind of gets in the mud because I can't get in the mud down there with them in processing.
Yeah, I don't understand it either. They always talk about this diluting process.
That's a bunch of BS. That it's a false narrative. There really is no need for products like that, regardless of how you process it. 5 years ago or 8 years ago, those products didn't even exist, and people were still consuming. So I'd like to know. I mean, I know I appreciate you playing devil's advocate. I think it's important that, you know, that you see that side. But 8 years ago, those products weren't available. Why are they available now, and what's the reasoning behind it? There really is no need to have products that big or that potent, regardless of how you process it. I think what they're feeding you a line of BS to make it sound scientific or justify why they need this product that strong. There literally is zero reason for that. I mean, even the country of Canada is starting to address potency issues, and the state of Washington is addressing potency issues. We tried to address potency issues here, but the industry fought tooth and nail to get it out of that bill. Vermont is probably the only state that has caps on like 35% flour and 60% concentrates, which, although we know is still too strong, but at least they have those restrictions. And the other reasoning they're going to say is because it's going to prevent the black market from doing it, which is I mean, it doesn't matter. The black market is going to remain as strong as ever and thrive better in legal markets. I mean, we have a very thriving black market in Colorado. It's worse than it was 10 years ago when we voted to legalize for recreational purposes. So the
Yeah.
black it actually they feed each other. I think the licit market feeds the illicit market. And the licit market always uses these excuses that are lame to justify what they're doing. And I think there really is, I would ask or request the data that supports their position, because I'm not
Yeah.
aware of any data saying, oh, we need the 90% because we're going to distill it and do whatever, put CBD back into it, which is a bunch of BS, because what they've done is bred down the CBD and increased the THC content. And I can send you slides on this, that the gap has widened over time. It's not shrinking. The
Okay.
ratios are not the same. Like the Sativex, which is not available in the US, which is a natural THC CBD rate 1-to-1 ratio. It's available in Canada and Europe. It's not available here, but it is a 1-to-1 ratio. But then you get into these made up numbers of 5-to-1, 10-to-1, 20-to-1, based on zero science, based on anecdotes and patient responses or industry preferences. That's where they're coming up with this information. There really
Yeah.
is no science that I'm aware of that would justify a 90% product.
Okay.
And I'm hoping to track down the folks in Israel next week, who have done a lot of research in this space, and ask them these questions, and
Yeah.
ask them for the science and the reasoning and rationale for high potent products. And I don't think in Europe, based on my conversations, have you heard of Marta DeForti and Sir Robin Murray? They've done a lot of publications. They're at the King's College in London. They've done a lot of publications on the link between schizophrenia and cannabis.
Okay.
But the products in the UK and in Europe are 10%. I mean, Amsterdam won't sell anything stronger than 15% THC because they consider it a hard drug and a hallucinogen. And they're the gold standard. And actually, Amsterdam, you can find this on the internet, they're trying to restrict, they're starting to shut down the cafe shops in Amsterdam due to crime, the rampant crime and illicit other drug use in Amsterdam. It's become a
Wow.
nightmare over there. Yeah, you can
So
find
do
that on
you,
the internet.
well, we will be able to find that Amsterdam's trying to limit to 15%.
Yeah, and if you have trouble, I have it somewhere buried on my computer, but yeah, you can probably find it on the internet.
I think that one
Okay.
would be helpful. I was using like an AI search the other day because I've never seen anything really over 10% to have medical efficacy. So I was searching, and you can't find it, So I love us just kind of going, please find, asking them.
Well, the
for the
other
industry to
interesting thing is
supply the
that
research.
they always will. You've probably heard of the National Academy's paper from 2017 that did kind of a scoping review of the benefits of cannabis.
Mhm.
And they always fall back on that. And in my world of pain, I can tell you, and I've emailed the authors, and so did Bertha Madras. We were emailing at the same time when they concluded that cannabis has good benefit for pain. They used products that were not available in the US or the synthetics. They did not study dispensary cannabis, which has its own Pandora's box of problems. So there's really been zero scientific study on dispensary cannabis in its treatment for medical conditions, particularly in pain. And there's many international pain organizations that don't support the
Right.
use due to the weak science, and that includes the International Academy on or the International Association for the Study of Pain. It's probably the largest international pain organization on the planet. They don't support using it. And there's several other international pain organizations that don't support its use because the data is just too weak, especially when you're talking about dispensary cannabis. It's simply never been studied, and there's too many variables. I mean, the potencies are all over the map. The patients have no idea what they're using, and they're frequently contaminated with things that they shouldn't be consuming, like pesticides and anticoagulant rodenticides and all sorts of garbage.
Right. What, Jody, you have a question or anything? I'm just typing some of the stuff he just said.
Yeah, I know. I've been writing as well.
Okay. So drug testing, and let me know when you got to jump off, Doc. Drug testing, the process of drug testing employees. So this has come up. I think Senator Landis actually brought this up last week. You know, that in Ohio, they're going to leave it up to the employers to determine their policy. And we had Senator Hoagland say, I'm an employer, we have a zero tolerance policy. How will this affect, you know, because we legalize hemp, we got medical marijuana now. So, you know, so how, I mean, what are they supposed to be able to do? Can, you know, I know New York has made it illegal to drug test most employees, except for those that are federally mandated to be drug tested, like school bus drivers. But my thing was, if it's important for a school bus driver to drug test, you know, to be drug tested, why is it not important for, you know, anybody else who's smoking dope to not be tested, who might be driving next to my child on the freeway?
Right. And there was a recent study that you probably could find this on the internet, that there's some, I think Amazon won't test its drivers anymore, which is going to be a dangerous precedent. And there already have been incidences of Amazon drivers involved in fatal crashes that were impaired. I think you can find that on the internet. I know Phil Drum has probably some references on that, but I can find that for you for sure. They're setting a dangerous precedent if they're going to get rid of or leave it up to the employer to determine drug testing policy, because it doesn't work like alcohol. And that's what, you know, it's so ironic where they say, well, let's regulate like alcohol, but they don't work the same. It's apples to oranges. I mean, it's, you know, as you know, marijuana is fat soluble and stays in your system longer than alcohol, which is water soluble. And so the impairment can persist longer than with alcohol. And that's, to me, setting a dangerous precedent. There's been incidences of actually school bus drivers, that there was a school bus driver in Denver that I hit. I think there was thankfully no children on the bus, but ran into some cement block and was severely injured and tested positive for marijuana in her system. And so I think they're setting a dangerous precedent by doing this, because in safety sensitive positions like pilots and bus drivers and any commercial drivers, they need to have testing. And they always say, well, it's legal now, we shouldn't have to test, but it's an impairing substance.
Yeah.
You know, and that's kind of my concern.
So the question comes up there, you know, you can't test for impairment. So, you know, Senator Hoagland said, you know, I test a guy, I smell it on him, I test him, but, you know, he said that it could be, you know, you can't know how long ago he smoked it. So you can't know how impaired somebody is. Therefore, if they can legally smoke it, you can't really test for it. So we just can't test. That makes perfect sense to these senators.
And I can understand the rationale, because just like there's hospitals now that won't test their medical providers, you know, in their pre-employment physicals, they won't test them, because you can't use a blood level to determine impairment. I mean, some states like Colorado have a 5 nanograms per ml is driving impaired, but we know that those per se limits are worthless. When it comes to driving impairment, you need the drug recognition experts to determine impairment. But you have to wonder, you know, the chronic user, their levels are going to be very high. And so I can see the argument that, well, if they're not stumbling down the hallway and they're not bumping into people or crossing the line in oncoming traffic, you know, they're not impaired, but they certainly could be impaired. And I think that the fact that you have a substance that is potentially impairing to that degree is very concerning, that they're just going to turn a blind eye and bury their head in the sand. And I guess the question is going to be to them is like, what body count will it take for you to change your mind? because there will be body count, period. There
Yeah.
will be. They cannot say that's not going to happen, because it is going to happen. It's happened in every single state that's gone down this road.
Right. I actually give them AAA's
Yeah.
report base, and saying that there is no healthy limit, right? There is no safe limit for THC in driving.
No, nope, there isn't.
And that
Because the
everywhere
naive
legalization.
person, the naive person may take one hit and become impaired. The chronic user may eat, 20 gummies and feel that they're okay. Just as a personal experience with my own medical marijuana card, I told you about that, right?
Yeah.
Yeah. So I actually, when I got my renewal last year, I asked the referring doctor, I said, should I stay away from a certain potency? And the answer I got from a doctor was, you can use as strong of a product as you want, as long as you think you're okay,
Nice.
and right? I'm
Sounds
like,
like medicine.
sounds like medicine to me. So, I mean, sounds like booze. I'm like, well, go ahead and drink as much vodka as you want. As long as you think you're okay, you should be okay to get behind the wheel. Don't worry about it. And then when I asked her, I said, well, what if I have an adverse event like palpitations or start getting chest pain? I can't get my records from her. I can't call her. I can't circle back with her. And I think that's part of the loophole of these medical programs, is that they protect the recommending doctor. And they're not following, they're practicing substandard medical care. They don't maintain records. I can't get my records. But that by law, they're supposed to maintain records, and I can't get it. And I brought it up to the state, and they just ignore me.
Dr.
Wow.
Hanna, I know one of our senators is going to go on PTSD. Is there any just nice language? I know you've provided studies.
Yeah, there's plenty of data that it doesn't help. And what I would throw at them, because
Yeah.
everybody knows this one. Do you know who Chris Kyle is?
Yep.
The American
saw that.
sniper?
Mhm.
Yes.
Do you know he was killed by a veteran who had cannabis psychosis, who was self-medicating for PTSD?
Okay.
Smoked that morning.
He smoked that morning. And I
Mhm.
spoke to the forensic psychiatrist that testified at that case. I said, can you verify with me that he had cannabis psychosis? He said he did. And he was a veteran. He had PTSD, and he was a murderer. And the psychiatrist said he had cannabis psychosis, and that was part of this whole murder trial. And there's plenty of data. There was some newer data that came out in the past month or so. If you send me an email that you need some more information regarding the lack of benefit in PTSD, and actually the Veterans Affairs doesn't allow the use of cannabis for PTSD. The
Okay.
VA.
Veteran Affairs. Okay.
One of the senators, he's a retired Navy SEAL, I think is what his designation is. And I know he's favorable for that particular issue. So that will be helpful. Yeah.
He will, if you, just FYI, if you say PTSD, he'll specifically say TBI, traumatic brain injury.
No data to support it. Zero.
Yeah, I'll forward you, Jody, some of the research that Dr. Finn sent me, but he didn't even bring it up last week. He was more talking about employment, which I thought was crazy. But I had a whole folder of like six different, reasons. I still have it for him that he can look at. But there was something that said there's presently no study showing that TBI or that marijuana is effective in TBI treatment.
Zero.
Okay.
Nothing.
Yeah.
Any of the studies that he might quote were either they were poorly designed, low number, short duration, variable products. And so there really is no good solid research on the benefit of in TBI.
Okay.
So Doc, one of the things I try to do is number one, I try to lay the foundation, and I use you and Dr. Sabet to do so. There is no difference between medical marijuana and recreational. There's only one industry, right? You have to lay that foundation or everything gets conflated really quick, right?
Right. And there's the only difference between medical and rec is the revenue.
Taxation.
And then I would ask them if they could even spell P&L, because I've said this to my city council members. You can't spell P&L. What's that?
I ask them all the time. And yeah. So I quote you on that. The other thing I try to do is get them to understand there's a difference between cannabinoids and cannabis.
Yes.
That the FDA is all about researching cannabinoids and
Mhm.
Epidiolex and the Dronabinol and all that stuff. But they're also against just saying, hey, if you want these same if you want the same benefits, just let everybody smoke cannabis.
Right.
That's two different things.
Two different things. And then the Farm Bill has created this whole loophole on isomers and acetylated products where the delta 8s, 10s, and HHCs, THCPs, THCO. They've created this market, and I think there was I think it may have even been Washington that is starting to restrict. They just said no more hemp products. These cannabinoids that are being mass produced by hemp. So they found the loophole, and the industry knew this, they knew it when the Farm Bill passed. They knew exactly what they were going to do, because this science has been out there for decades on when you take CBD and you manipulate the molecule and you make THC isomers out of it. And there was a kid that died from Delta 8, I think, in Virginia, and the mom's going to jail for murder. So, that's a whole other discussion and conversation.
I did have a conversation the other day with people from Farm Bureau from Michigan and Ohio, and 2018 Farm Bill is up for renewal. So they're looking at language to at least kind of negate some of that Delta 8, those isomers in the language. So hopefully Farm Bureau can probably get behind that's not what they intended hemp production to do, is create.
They didn't intend it, but the industry was happy they did it.
But at least if they're willing to do some modification on the Farm Bill, I think that would be at least a win for us.
Yeah, it's a step in the right direction for sure.
Which leads to a question. So, what are we supposed to do, Dave? The bill sponsor, he literally says, we didn't know. We've got to fix this. Everybody, all of them, the sponsors and the proponents said that this is a dying program, all of them. And we need to fix it between now and July, or the recreational program will eviscerate, quote, the medical program. And then I asked them, what state in the nation have you seen a strong medical marijuana program persist after recreational? And he could not name one. He said the closest was Colorado, and I thought you'd get a kick out of that.
Yeah, that's so funny, because the medical is just a toehold. It's the entree to legalization,
right?
They parade grandma who's dying of cancer and the seizing children on TV in front of the voters, and they pulled the heartstrings and they said, okay, well, yeah, grandma can use, who cares if she's smoke some weed, if she'll be dead in 3 months anyways. They don't talk about them anymore. They're gone. They served their purpose. They were pawns for the industry, and they've served their purpose.
Right. What I say there is, for every one person that may have been benefited by marijuana, there are 1,000 who cursed the day that marijuana ever came into their families' lives.
Absolutely.
And if
it's worse than tobacco.
Community,
we already have legal drugs that have created societal nightmares with alcohol and tobacco. We already have that. So why are they can't even see the writing on the wall that we just created another addiction for profit industry that's going to create more harm? Because what about the guy that says, I smoke a cigarette to ease my stress, or I have a glass of wine at the end of a stressful day. We don't encourage our patients to do that. Why would we encourage our patients to use another impairing substance that has no scientific foundation in treatment of their conditions?
Good. That's awesome.
Yeah.
Oh, okay. Drug driving, I guess, would be the same problem, right? I mean, how do you, the sheriff gets into this, how can I even test if somebody's, impaired? Same basic thing. So here we've got the pharmacy board versus commerce. And I guess it's the same basic thing across the country. It starts out in the pharmacy board, and now they want to move it into the Department of Commerce. And there's all kind of business reasons why they have to do that. I don't know. Would you be able to speak to why that's a bad idea?
Again, they can't spell P&O.
Right.
They talk about how much money they're going to make, when we know the other addiction for profits make a ton of money for their industries, but we know what the societal costs are.
Sure.
They're huge. They're astronomical. And I would ask them before they do that, they should do some data research on what are the societal costs on marijuana. You saw the CCU, the Colorado Christian University report from a few years ago that for every dollar generated, it costs $4.50 to
$4.
regulate.
Yeah.
I don't know if the 450 is maybe a little inflated, but it's certainly not a money maker. We know, addiction, driving impairment, hospital, healthcare utilization, all these things. You saw the Quest data on marijuana in the workplace. If you haven't seen that, that would be circling back to your workplace issue. It's like the number one, the amount of positivity in pre-employment drug testing has gone through the roof with cannabis.
Oh, I need that. Yeah. Quest data
Yeah, the
on
Quest
drug
data.
driving.
No, this is on
Workplace.
on workplace.
Workplace. Okay. Lord have mercy. I thought I was done doing the research side of this. Every
You
time
did
I
a great
call
job last week, David.
thanks. Every time I call you, Doc, it's like another week of research. I've
Well, you
got
know
4
what?
other
I mean, the
bills
thing
running
is,
too.
the data changes on a daily basis. I mean, I read at least 1 to 2 papers a day on this. I mean, it's constantly evolving, but I can tell you that the data on harm, there's so much information that any real benefit that may be there possibly is far outstripped by the data on harm.
Okay.
I mean, how many dead and poisoned children is it going to take for your community to say, okay, we did a terrible job? If I'd ask, what state's done it right?
Yeah.
None. No state's done it right. I mean, we're running into, driving impairment issues. The child poisonings are going through the roof. That's happened all across the U.S. and in Canada. The potencies have gone through the roof. We have these mass shootings. There's this link between violence and cannabis use. The one thing that has become one of my platforms is the in utero and exposed babies data. Have you used that or know much about that?
We haven't
No,
used
I
much
just
of that. And I know
What's
it's
that?
there. I don't know why we haven't though.
I would use that because honestly, if marijuana was truly a medicine, knowing what it causes to the unborn, it would be pulled off the shelves. And that's based on the ABCD data and the NIH data that came out in September. and some of the exposed baby data that I have from Connecticut. I mean, it's the most common substance found when a kid's exposed in utero is weed. And what happens to those babies? They have behavior problems. They have psychotic-like experiences when they're 10 years old, even though they're not using. And that's intergenerational.
So number one substance found in babies
Exposed to anything. The Connecticut data, I think it was 80% were marijuana, 20% were opioids, and like 3% were alcohol. It was like 4,700 babies in a 28-month period.
Dang.
That's huge.
Yeah.
And I think how you bathe that would be very compelling.
Yeah, and
I
it's not
like
my-
where
it's
you
not my
said, and
data.
we would pull it off the shelves. If this was any other type of medicine and we saw this harm, we would pull it off the shelves.
Oh, absolutely. And nobody has connected those dots. When you have, and so it's the ABC, and I can send you the papers for sure.
Okay, please do.
The ABCD study, I think that was out of Canada. And the NIH followed that with a paper in September saying that those problems, like so the attention deficits, the antisocial behavior, aggression in these exposed kids persists into adolescence.
And you
I
said
love those studies.
when I
What's
was
that?
sitting in your, she said she loved those studies. When I was sitting in your office, you showed me, and it's in your PDF, but you said that THC is the number one substance found in kids who've completed suicide 10 to 19.
Yep.
Is that still accurate? Okay.
Yep, it's gotten worse. I think if you looked at 10 to 14, there's lower numbers, but if you really look at the high school kids, 15 to 19. It's like
Mhm.
33. It's like a third now. It's over 30%.
Wow. Okay.
Yeah, that is all really compelling for testimony for us because the state is so concerned about the mental health wellness of our young people. We continue to get dollars into our communities, but we're fighting a losing battle as long as we're pumping drugs in at the same time.
Right. Mm-hmm.
So last quick question, and then we'll wrap up. I know you're getting ready for your day. What do we do, right? So we've got it here. We've got medical marijuana. What do you expect us to do, Dr. Finn?
Well, look at your overdose data.
Okay.
Yeah, I'm sure it's still going up.
Absolutely.
So I would ask them. I said, the number one reason people use it is for pain, right?
Right.
And it's happened in Colorado.
70%
well.
here. Mhm.
Yeah, here it's almost 90. That's like the number one diagnosis, and that's how I got approved. I got approved for severe pain, even though my pain's minimal to none.
Right.
But they never asked me my pain level when I got my card. But I was approved for severe pain in a minute. Ask them, say, okay, if it was that much of an opioid substitute, right? I would, the things I would look at if you have time is look at your overdose data, knowing that it's the most common reason in Ohio for people to use, but your deaths are going up. Not only opioid deaths and fentanyl deaths. And I published a paper that marijuana states have higher fentanyl death rates than non-marijuana states. I can send you that graphic as well.
Please. Yeah.
Because they're just going to say, well, fentanyl just kind of spun off into its own thing, but that's not true. They all play well in the sandbox. And ask them. So, okay, here's the graphic in our state, and naloxone is being used more readily, right? So that you're saving more lives, but the drug deaths are going up despite that, right?
Okay.
So, and then I would ask them about, the suicides. Show them the suicide data. I mean, it's the number one in a lot of states don't even test it. They don't test kids or even adults that complete suicide. Why is that?
Yeah.
So, I mean, you talk about societal costs.
Yeah, it would take me some time to find that. Man,
Oh,
I
you can probably
appreciate-
find the overdose death data on your state website.
Yeah, OMOS has it on there.
Mm-hmm.
Okay. Jodi, any other questions for Dr. Finn?
No, you know what? You gave us a lot to think about. There were definitely things that we weren't touching on. I think that maternal health, babies in utero, I really like hitting on the suicide piece of it. And I love just being a little more confident that, okay, this whole diluting thing, it's crap. Because every time they all parrot this, well, we have to do this and then we dilute it and it costs more on the system. And every one of us are going like, we don't understand this. Like, we don't understand this. So this is helpful. Just it's bunk, like
Right.
Find us the research that says this is what you're doing.
Right. And I think that's what the industry tends to do. Is I'm trying to think that there was an old saying. It's like, if you can't, you have to baffle them with something, and if just basically they create mass confusion to get
And I think
what
that's
they
what
want.
this one is, this diluting, because they all parrot it. Every single senator has heard this language and we don't understand what they're talking about. So it leaves us kind of speechless when they're doing
Ask
this.
them.
Because we're like, I don't understand. Like, what are you
Ask
talking
them.
about?
Put them on the spot.
Okay.
Say, okay, you're parroting it. Explain it to me. I want you to explain the science behind it and see where they go with that. They're going to be like,
The sponsor of the bill described it like making orange juice. The day that
God.
he sponsored the bill on the floor, he said, when I squeeze an orange, I don't just give you, do you remember that?
I do.
That was what his analogy was, making orange
terrible.
juice.
It's
And we were
but,
again confused, like, like we
well,
don't really understand.
how many children end up on a ventilator from orange juice is what
Yeah.
I'd ask them.
Okay.
And I think using the child poisoning data is going to be very impactful. Use the graphics and the geriatric poisonings. Have you seen that data too?
No.
The number of people that are over the age of 65 are flooding the San Diego emergency rooms from their cannabis poisonings. 1,800% increase in like 5 years or something ridiculous. And the child poisonings like 1,300%, not 13% or 100%, 1,300% increase of kids getting sick. What are they going to do about that? I put it back on them.
Okay.
Yeah, I wish, the thing is they never ask the industry folks the tough questions. They ask us.
Well,
They
ask them
never
back.
ask them the tough questions. Yeah.
So yes, the dilution in orange juice. Well, explain that to me better so I can fully understand it, and they will have nothing to say because they don't understand it themselves.
Yeah. Gotcha.
Okay. Yeah. That orange juice one was kind of funny.
It's funny, but it's really scary.
Yeah, because we didn't know how to respond. I
Mhm.
mean,
I mean, I like orange juice. Like, what man has never OD'd on OJ?
Right. Honestly, and how many kids end up on a ventilator from drinking orange juice in the morning? None. Right? It's
Yeah.
literally an apples to orange comparison. They're using orange juice, but where's the apple? That they're explain the apple to me now, because that is the worst analogy I've ever heard. It's pathetic.
Man. Okay. Listen, thank you so much.
Very much.
Safe travels and
Thanks. I've got more.
everything.
Trust me, I've got more if you need it.
Hey, thank
Okay.
you for your work on this and commitment and helping us out.
No
sure.
worries.
Take care,
Appreciate
Doc.
it.
All right, guys, take care. Bye-bye.
Thanks. We'll see you.